Yes, good morning, good afternoon. Still, this is our next video about gingivitis. Like we have talked about already, the gingiva. The gingiva is part of the periodontium. And once we are talking about gingivitis, we are putting ITS at the end. It means the inflammation of the gingiva. And we are saying inflammation of the gingiva or the gum. It is characterized by the reversible. What do we mean by reversible? Unlike dental caries, this one is reversible. This is a reversible gingival inflammation without destruction of the tooth supporting structures. It means we can have the part which supports the tooth or the periodontal ligament. For it is not affected. We only have the inflammation or the inflammation or the damage of the gum. And like we have talked about before, inflammation means reddening, bleeding, swelling, and pain. These are the cardinal symptoms of inflammation. We already talked about what we call the gingiva because we said we can have three parts or three types of gingiva. What we call the free gingiva, so we can have the free gingiva. If this is a tooth, this is the free gingiva. We can have the free gingiva. We also have the attached gingiva, as we discussed in the previous video. And we have what we call interdental gingiva, or the type of gingiva which is in between the teeth. If you've not watched that video, please go back and watch the video about the gingiva. We have three types of gingiva, and we shall have also the signs and symptoms of a healthy gingiva. So now we are seeing the inflammation of the gingiva. So we are like the opposite. What do we mean? If we have the signs of a healthy gingiva and now we have a sick gingiva, we are now having signs of unhealthy gingiva. Inflammation of the gingiva. So what do we mean? Healthy gingiva, we are having three parts: attached, interdental, free gingiva. Now, we are saying, remember we also talked about another function, another part called plaque. We said once you have microbial deposits on the teeth, these microbial deposits, they can be having bacteria. So this bacteria is responsible for gingivitis, because bacteria will always be having will always be always secrete endotoxins. Endotoxins will also now cause the inflammatory response on the gum, because the gum will always defend itself, and by defending itself, after the bacteria has produced endotoxins, it shall have it as gingivitis. So we can have the bacteria responsible for gingivitis, what we call plaque-induced gingivitis, and non-plaque-induced gingivitis. In other words, bacteria is the one responsible for gingivitis, but you can also have some other part of gingivitis which is not which doesn't happen due to bacteria. So that's why we have the plaque-induced gingivitis and non-plaque-induced gingivitis. We said for here plaque-induced gingivitis, we shall have bacteria in plaque, because we say the plaque, it is the what attaches on your tooth and adheres so firmly that it cannot be removed by a stream of water. But once you use mechanical forces, for example, toothbrush, it is able to do what? To get away from your teeth. We also added the other time that in case you do not brush it quickly and saliva bathes it, this plaque can turn into calculus. Therefore, plaque-induced gingivitis and non-plaque-induced gingivitis. So we can also have another gingivitis which is not from plaque. What do we mean? We can have, if there's a bacteria, if there's a viral, if there's a trauma. Some people who use toothpicks, they just injure the gum and it swells, trauma. If it's due to fat origin, if it is immuno-inflammatory, yes, genetical, yes, a foreign body can cause it, yes. Habits, for example, smoking, we shall see the smoking under there, how it causes it. Systemic diseases, for example, diabetes, for example, pregnancy. We have what we call pregnancy, the gingivitis in pregnancy. So all this can be non-plaque induced. Also have what? Plaque induced. Now, having talked about different parts of the gum, where we have free gingiva, now this one becomes very important. Where we have free gingiva, inflammation of the free gingiva is called marginal gingivitis. Inflammation of the attached gingiva is called diffused gingivitis. Then the inflammation of the interdental gingiva in between is called papillary gingivitis. You take note. Marginal, diffused, and papillary gingivitis. Now, we shall say clinically, when you look at the gum, it may be practically impossible for you to differentiate that this is the attached gingiva which is inflamed and the free gingiva is not inflamed. Then now the interdental is inflamed, the other one is not inflamed. Because of that, we combine all the gingivitis, whether attached or diffused or papillary, and we call it chronic marginal gingivitis. Chronic marginal gingivitis. In other words, chronic marginal gingivitis, we are combining marginal, diffused, and papillary gingivitis. And usually in your papers, you shall be always given chronic marginal gingivitis. What causes it? How can you manage as a clinician? Usually, people will be having chronic marginal gingivitis and you're expected to simplify it in this way. One, what is chronic marginal gingivitis? We are saying inflammation of the what? Of the gum. And we are combining all the three. What is usually the cause? We are saying number one is poor oral hygiene. Poor oral hygiene. We are saying poor oral hygiene. Poor oral hygiene. People neglect the oral cavity. They brush and leave food there. Bacteria is always in the oral cavity. Bacteria mixes the food. We are always forming plaque. This plaque can always be the source of gingivitis, because you are saying the bacteria in this plaque is going to produce lipopolysaccharides, or what we call endotoxins. Endotoxins will now cause the gum to be irritated, and the gum will now defend itself in the immune system of the body through the gum. The gum will defend itself by producing the response of inflammation, because inflammation is an immune response. So in the way of defending itself, the gum produces the immune response of swelling, what we call inflammation. By so doing, these lipopolysaccharides or endotoxins, they make the gum what? Swell. We also have forte lips here. Forte lips here is people who don't close the mouth well. They also people have open mouth. You know, saliva is very important for washing or doing oral clearance. So the moment we have forte lips here, or people who don't close the mouth very well, we shall always have drying of the mouth. And this one will cause what? Will cause gingivitis. Irregularities of teeth. We talked about teeth irregularities. There are some people who can be having crowded teeth. You find the tooth is there, another one is there, another one is there. So these teeth, another one. So you find the teeth are so squeezed that the teeth are so squeezed that they are difficult to clean. Of course, brushing becomes difficult, and even flossing becomes difficult. So when this one happens, we find there is a lot of plaque, and the plaque-induced gingivitis will always be what? A problem. We have smoking. When I talk about smoking, smoking is only, I don't know how many advantages we have in smoking, but smoking is dangerous in the body, not only to the lungs, but smoking is always not encouraged. My brother, my sister, if you have someone who's smoking, you need to explain that when somebody smokes, we have increase in advanced glycerated end products. This one impairs the immune system of the gum, and therefore can always lead to what? Gum bleeding. We can have some time to explain more about that. Secondly, apart from impairing the immune system, we also have the collagen metabolism of the gum is impaired. When the collagen metabolism, because you know the gum is the formation of the gum is through the collagen fibers. So the moment the collagen metabolism is impaired, we shall always have what? Gingivitis. Before I leave again smoking, we shall also be having what we call the nicotine in smoking. Nicotine is very, very dangerous because it causes vasoconstriction, or the vessels becoming smaller. When the vasoconstriction, when there is a constriction or the becoming smaller of the blood vessels, we shall have little or limited oxygen supply to the gum. By so doing, we shall have gum what? Problem. We shall have time to discuss both smoking and diabetes in relation to gum disease. But for now, we are talking about impaired immune system, limited collagen metabolism, and oxygen deficiency in the gum due to nicotine as a vasoconstrictor. After speaking about those few points, let's continue. Or they're about smoking. We have hormonal response. For example, hormonal, for example, in puberty and menopause. Usually, once we have all these ones, we shall have increase in serum in the blood, and usually we shall have people who are in menopause, menstruation, and periods, and we shall have increase in serum in the blood, and we can always have what? Bleeding of the gum. When it says so, it's bleeding of the gum, it is always very good to take history, whether somebody is in menstruation period or menopause or any of these puberty periods. Stress, a common factor in many. I talked about DM in diabetes mellitus. We also, like in smoking, we also have the increase in advanced glycolated end products. And these advanced glycolated end products will always cause impaired blood supply, impaired transport of oxygen to the gum, limiting the gum repair and causing gingivitis. Poor nutrition can always be another cause. The gum also, like any other living part, needs to feed well. Feeding in terms of nutrients. So in case we do not have poor balanced diet, we shall not have food, or we shall have nutrients for our gum, especially vitamins. What are the clinical features? Clinical features of gingivitis, of chronic marginal gingivitis. In a student, there are things which you should not forget. The moment we talked about gingivitis, and you know the cardinal symptoms of inflammation, where you have pain, reddening, swelling, temperature, those should be number one, because we are talking about chronic marginal gingivitis. And the good thing, we are saying the gum is the one which is swollen. That's why can have reddening, bleeding of the gum. When somebody brushes quickly, shall have reddening or bleeding of the gum, on blushing or not. Whether somebody brushes or not, reddening of the gum. And we are saying the gum can even become tender. The gum is even paining. Yes, halitosis. Talked about halitosis. You need to watch one of the public videos on our YouTube channel about halitosis. Halitosis or bad smell. Because of the gum, how it is tender. Somebody doesn't even brush. We talked about a full video about halitosis. Please go and watch about halitosis. It is good for you to know why halitosis happens and how you can solve it. Next, receding gums. What is receding gums? We've talked about the level of the gum. The gum, this is the enamel, and of course this is the cementum from here up to here. what covers the root of the tooth from the enamel junction up to here. This is the cementum, and from here the crown is covered by enamel. So this is the cemento enamel junction, and this is what should be covered by the what? By the gum. This should be the gum level ideally, but sometimes due to caliculus which comes from the hardening of the plaque, it keeps on pushing this, and you shall notice that the gum is being seen, is being receded or pushed down, and in some people you shall find the root of this tooth is being seen, what we call gingival recession. So the receding of the gum is what we call what? The receding of the gum, or the pushing down of the gum to expose the root of a tooth from its level up to here is what we call gingival recession. So gingival recession is always another clinical feature. We have what we call pocket formation. Yes, pocket formation. What is a pocket? We talked about this, that between the tooth and the gum, we have what we call a gingival crevice. We said a crevice is a normal, this one is normal, this area between the tooth and the free gingiva, and it's always between 2 to 3 millimeters. And we said to measure this, we use a periodontal probe, and it is normal. We said this area is bathed by a what we call gingival fluid, and we gave the 4 importances of the gingival fluid. But we said once this part is diseased, it is called a pocket or a periodontal pocket, and can easily be more than 3 millimeters in depth. So this area here is what we call gingival crevice. The moment it is more than 3 millimeters, from 4 up to maybe 6 or 7 millimeters, we shall call that periodontal pocket, or the area around the tooth is affected. So that is what we call what? Periodontal pocket. Because of that, we shall have pain, and because of the same thing, when it is attached from the tooth, it is no longer making a collar of a tooth, the gingiva, it now becomes what? This gingival detachment. We said as this continues, the periodontal ligament will be affected, and we shall have loosening of teeth. Although this one is a cardinal feature of periodontitis, but you can also bring it at the end, increase in temperature and the caliculus deposition. So what can we do as a management of chronic marginal gingivitis? We have to do what we call scaling. We can call cleaning of the oral cavity, but scaling and polishing. What is scaling and polishing? Scaling and polishing, we are removing Here, scaling and polishing, we are removing plaque, we are removing calculus, we are removing stains on the tooth. And what we call cleaning, we shall remove it manually. And manually, can use, maybe there are many types. There are manual ways. There are also ultrasonic scaling ways. But what we are talking about is removing them. We call it, we can use scalers, we can use ultrasonic scalers, which can vibrate around here, removing what? All this area, removing the calculus. But this type of cleaning of the gum is what we call what? Scaling and polishing. We call it scaling and polishing, cleaning of the area between the tooth and the gum. Some of these calculus can be between the tooth and the gum in the area we shall call what? In the area we shall call subgingival. In the area just under the gum. And the tooth seems clean, but in this area, in the subgingival area, is what? It is affected. So, scaling is really done to clean that area. Oral health education. In the public video, we talked about oral health principles, where we talked about oral health principles, where we talked about brushing teeth, good, where we talked about flossing, in order not to allow deposition of plaque, because plaque-induced gingivitis can always be one of the major causes of what? Chronic marginal gingivitis. Plaque can always be the cause of chronic marginal gingivitis. So, oral education about how people should take care of the oral hygiene, how people should floss, how people should eat a balanced diet, can always be talked about here. Ascorbic acid, vitamin C, ascorbic acid helps to boost the gingival what? Immunity, and is always very good in giving. Antibiotics and painkillers is another one. In simple terms, this is how we manage chronic marginal gingivitis, and we said the moment this complicates or the moment is not treated, we shall have majorly this loosening of the teeth. And our next video is the complication of chronic marginal gingivitis called chronic periodontitis. If you think this video is really important to you and simplify life for you, kindly subscribe. Thank you.